Hello, my name is Janet Gichana. I'm going to talk about maternal mortality in Afghanistan. Afghanistan is located in Asia bordering Iran to the west, China to the northeast, and Pakistan to the east and south. Currently, it has a population of 32 million people. The population is comprised of primarily youth and children. 46% of the population is under 15 years of age. Pashto and Dani are the official languages in conjunction with Arabic. My role today is a public health nurse, and at this moment I would like to acknowledge the presence of officials from the Bill and Melinda Gates Foundation. The objective of this project is to investigate the causes of maternal mortality and formulate interventions that will reduce these high mortality rates. Maternal mortality affects women of baby-bearing ages 15 through 49 who live in the rural areas mostly. Herat has the highest mortality rate, where there's 593 deaths for every 100,000 live births. The highest mortality rates were between 1998 and 2002 due to the political instability in the region at that time. There are many contributing factors to high maternal mortality rates. We've already talked about the political instability, poor healthcare infrastructure in terms of lack of supplies, lack of healthcare facilities, and the healthcare providers have little to no education, poor education systems, poverty, lack of social support for women, and the cultural norms in Afghanistan. At the moment, males are the sole decision makers, therefore women have no say even though it affects their health. Now I'm just going to use a socio-ecological model to further explain the causes and a little bit more about the high mortality rates. At the individual level, the women lack knowledge about the dangers of unsupervised home births, for instance, therefore posing a higher risk of the maternal mortality rate. At the interpersonal level, they lack the social support as earlier discussed. At the organization level, healthcare organizations like the Bill and Melinda Gates Foundation are hands-on at providing resources and education to combat this epidemic. Lack of infrastructure and healthcare facilities contributes to this epidemic at the community level. Finally, policies in Afghanistan are not conducive to health promotion in women, and that has to be changed. This table right here shows all the different levels into more detail, into more specific details, and to help with understanding. There are numerous interventions that can be implemented to reduce maternal mortality rates. First, promotion and encouragement of prenatal screening to ensure early identification of complications, formulate birth plans, and support both the mother and the family in general. Secondly, proper management of postpartum hemorrhage. This can be done by checking hemoglobins before birth to ensure that they are within normal limits. This prevents anemia and also encourages the consumption of iron through diet or supplements. The use of anti-hemorrhagic agents during active bleeding, and in extreme situations, blood transfusion protocols can be implemented to prevent hemorrhage. Another intervention is the utilization of antibiotics to prevent sepsis. In Afghanistan, since most women have their children at home, they are highly unsanitary conditions. Therefore, it's recommended that a broad-spectrum antibiotic like Ansef is utilized unless it's contraindicated. To evaluate my interventions, I will anticipate a decrease in the number of postpartum infections, proper control of bleeding episodes during birth, increased prenatal screening, and most importantly, a decrease in the maternal mortality rates in Afghanistan as a whole. There are some expected challenges when implementing my interventions. Afghanistan is a multilingual nation. Therefore, language barrier is an expected challenge, especially in the rural areas. Cultural differences, lack of resources, and skilled healthcare providers, inaccessibility to rural Afghanistan, and poor healthcare policies are some of the expected challenges. To address these challenges, interpreters must be utilized to ensure effective communication, integration of Afghanistan culture into the intervention to avoid being disrespectful. Cultural competency comes to play where a healthcare provider is considerate and non-judgmental of their practices, requesting resources and guidance from international healthcare organizations like the United Nations that have navigated this area before. Therefore, they can be a good resource in terms of navigation and providing the resources needed. Providing training like appropriate sterile technique, comprehensive head-to-toe assessments, and hand hygiene is also important in training the healthcare providers. Lastly, advocating for policy changes with hopes that it will promote health and well-being in Afghanistan, not just for women, but for the entire population as a whole. This table shows my logic model, which showcases the inputs, the activities put, which is the interventions, the output, and the outcome, which is to decrease the maternal mortality rates and improve the healthcare status of the women in this part of the world. And my references. Thank you.